All right, guys, this past week, President Biden has signed into law the Inflation Reduction Act. I hope I pronounced that correctly, which will spend hundreds of billions of dollars for things such as housing, environmental concerns, and healthcare. That is correct. It will go towards healthcare. There are some things that I really like about this. However, I have more questions than answers, I feel like. Every article that I read mentioned Medicare. Every article mentioned Medicare and how things are going to cost less and how there are going to be caps on how much prescriptions will cost for Medicare recipients. And although I am definitely for caps on prescription cost, as something like 1 out of 2 Americans have medical debt. That is an unbelievable stat. That means 50% of the entire U.S. population has medical debt. That is unfathomable. Now, as someone who actually does have medical debt, I do. It comes and goes, things like that. I can understand how it happens, but still, 1 out of 2 people have medical debt in the United States of America. And this is hopefully going to help with that. However, again, it goes for the Medicare, Medicaid, not necessarily for those of us, such as myself, who have private insurance. I did not find anything about people who had private insurance, myself included, as to what we are going to do about these medical things that are going to cost more or less. Now, they did state in the articles that I did read, certain things will cost a flat rate, something like $35 maximum for an entire month's worth of insulin for it. You cannot be a diabetic and live without insulin, or you cannot be a type 1 diabetic and live without insulin. Insulin is a life-saving medication, and I am definitely for the $35 maximum for a month's worth of insulin. I feel that that's deserved. But it's the regular everyday prescriptions. Like if I get the flu, it's going to cost me $100 and some odd with insurance to get medication to help me get over the flu, which is a lot of money, especially when I have the flu and I'm probably not working for at least a week. It's not looking too good for the private insurance people. Now, as someone who was actually in healthcare and was around in 2010 when the Affordable Care Act sort of kicked in, if you will, I do remember changes coming, and I just remember all the LPNs getting laid off from the hospital. Yeah, I remember that. So hopefully this new Inflation Reduction Act does not end up being something like that. I would also love someone to cover what happens with private care insurance. What are we going to do about those of us who have private care insurance? I don't qualify for Medicaid. I pay it every month out of my check. Am I now going to be a Medicaid recipient? Am I going to get Medicare, Medicaid? Is that going to happen? We're going to sort of a socialized healthcare organization? I don't think so. I don't think that Congress will get bipartisan support to pass that. So those of us who have private health care, are we going to be dumped upon and we're going to pay more? What I would like to see is sort of what the Dallas Mavericks owner, Mark Cuban, has started, the pharmacy that he has created where they don't accept insurance and take very, very low rates, because the pharmacies or the pharmaceuticals, drug companies, are pretty much unregulated as to what they can charge. I would love to see caps put on what pharmaceutical companies can charge, say like 7% over tax or 15% over tax, whatever is like the standard for like towels or t-shirts or jeans. Like, I would love to see something like that. Doubtful that that will ever happen. I seriously doubt that that will ever happen. However, changes are coming, good or bad. We'll see in a little bit, but changes are coming. Hope it helps. If you like Nurses Making the News on Thursday, should be a playlist down below. On this side should be a video that YouTube says you'll like, and don't forget to like, share, and subscribe on that side. Hope it helps. Thank you much.